Thank you very much for the invitation, and thank you for your participation in this afternoon. First of all, I would like to clarify, I'm not working anymore for Semmelweis University, but by the time I done that study and I led that project, I was working in Hungary and I was working in the Semmelweis University. Just a few words about you understand the background, how I landed what I am doing now. I was a dental student in the early 80s when Professor Iolán Bánóci, I hope this name ring a bell for everybody, nearly everybody in this room, was a dean in the Semmelweis University in Budapest, and she was the big reformer of the dental curricula in the 80s. She was the dean who introduced the preventative dentistry in the curricula for the undergraduate student. So by that time I finished the dental school. I thought I learned a lot about dentistry, and I thought I learned a lot about, oops, there will be no title, doesn't matter. Learned about how we can prevent the oral diseases. So came the early 90s when I was the eyewitness with among the other colleagues, seeing a forced privatization in the primary dental care, which had a detrimental effect of the oral health in Hungary and I'm sure in other Eastern European countries. So my action was that I applied to make a master degree in public health in Hungary, which is not possible for dentists. So with a special license personally from the health minister, I managed to do the 4 years master degree, and I am still the single Hungarian dentist who has a master degree in public health, which means probably for everybody a lot, which means without public health knowledge and experience, there is really hard to make a shift, a paradigm shift in the dentistry. So after my master degree, I decided I attend to conferences. So over a decade ago, I started to go to European and international conferences. I met to Ken, I met to Paul Eric, I met Eva Wickström and a lot of other people, obviously. They influenced me a lot, and all the data which are related to the Hungarian epidemiology, mainly oral cancer, and also the bad DMFT, influenced me to do something. I became very impatient, and I said, I can't wait any longer. There is lots of evidence about how we can prevent, and we should prevent, and there is a lot of knowledge, there is a lot of science, why we don't implement in the practice. So with quite a lot of luck of the found, obviously I was just a dentist. I was a dentist with interest in public health. I managed to convince the health politicians and the politicians at the highest level in Hungary in 2004 and 2003 to start a national preventative program, which was not very easy, but I convinced them that by the time that the new election comes in 2006, we will have some fantastic result, and they can publish it as their achievement to prevent problems which are absolutely preventable. So I don't know how you will see. I mean, the title is easy, and the title is that my job is here to tell you the tale of what's happened in Hungary. If you see the two images, the left side is a gentleman who is a homeless gentleman who had a very advanced level of cancer in a very poor countryside, and we managed to find him, and he said that he is well aware that he has oral cancer, but please let him die. He doesn't want to go to any treatment. And on the other image, there is the gentleman is already not with us anymore. He's an elderly gentleman from West Wales in a very rural area, who was a very well-known professional, and he didn't see dentists for over 10 years because he had no access to the dentist. He was hospitalized with stroke. He was in the hospital for a month, and they said he has no problem in his mouth, and he had an inoperable oral cancer. Nobody in the hospital managed to have a look in his mouth and find out that he has a cancer. So my job is to give you an overview about what's happened and how happened in Hungary. You all know, I don't know why we can't see the data, but the data shows that in Hungary, the oral cancer incidence and also the mortality is far higher than in any other European countries except Slovakia. and the survival is very low if you compare it with Northern European studies. So the situation in Hungary in 2005 was the following. We had lots of dentists who were working in private settings. They had to buy their practices. We don't have community dental service at all. And by the law, the GDPs were obliged to perform an oncological examination. But obviously, they failed to do it. So I thought we have to find a new method, and we needed some action. Obviously, there is lots of evidence that screening the high-risk group for oral cancer is giving a good result. But the question was, who is doing the action, and who is responsible for leading the program? Because there was no other public health specialist in dental branch. I said, we will do it by learning by doing it. So we drew a program which we called Hungarian National Oral Health Preventative Program, which has lasted over a year. The annual budget for the whole program was 300 million Hungarian forint, which is around £1 million in the value. That was the goal, obviously, do as comprehensive it can be, a preventative program, which is working in the state-funded primary dental care with continuing support and expansion, and obviously the quantity and the quality was important. I had one mentor from the international community, and it was Professor Kenneth Eaton, who came twice, spoke to the minister, spoke to the well-known politicians, and he convinced them that we have to do a paradigm shift, otherwise the outcome is even more detrimental than before 2005. So we said the prevention should be primary and secondary. Obviously, primary is educating the people and giving tobacco cessation advice, which was an absolutely new element in the public-funded dentistry. Dentists couldn't believe that they are the right person giving smoking cessation advice. And secondary, obviously, screening the high-risk people, which were the low socio-economical groups, people who living in rural areas, people from the high employment areas, minorities, which were mainly the Roma people, the Gypsy people, and homeless people, and also other vulnerable groups. The dentists had to apply to participate. We got over 500 applicants, and we gave them as much as creativity and flexibility within the frame. It was their job to identify the high-risk groups. Dentists gone to prisons. In Hungary, we don't have prisoner dentists. A tiny, very young and very, very frail-looking young dentist, lady dentist, decided she will do prisoner dentistry. Other people gone out and checked people's mouths in absolutely, on the street. They checked people's mouths in homeless people's mouths on the street in the capital. Other people gone to the mentally ill people's residential home, old people residential home. A few colleagues decided that whereas we can find the smoker and the regular drinkers than in the bars. So they decided they go regularly into the bars and they promote the best practice, and this is what they done. So a few words about the time frame and the numbers. It started in September 2005 and finished in July 2006. Altogether, 205 dentists participated in the program. Analyzing their reports, it showed for us that over 700,000 people, which is 7% of the total Hungarian population, get some benefit from the program, and over 54,000 people from the high-risk groups had and oral cancer screening. Sorry, is an E missing. The result of the program showed that dentists saved lives. I can tell you the numbers if you can read it. Just 1 second. it was 15 early malignant lesions which has been detected. Oops. More than 60 premalignant lesions were referred, there we are, referred to the secondary care. Illiterate adults learned to brush their teeth. Previously, they rinsed with spirit only on a daily basis, because obviously dentists gave free toothbrush and toothpaste for the people who couldn't afford to buy any. Our dentists gone to educate people who were HIV positive, heroin and drug users, and prisoners. Roma children who are regularly smoking in the age of 12, they get health education about the risks. This is one of the images in the very, very poor countryside where the dentist gone to the bar, that's the name of the bar, Magdi Presso, and they had a poster that tonight it will be free oral cancer screening. Can you imagine a dentist who usually place fillings and do dentures and crowns, how brave they were to go into the bar, convince the owner of the bar that it has a bad effect on the business, and they go into the bar and they give a free screening for the regular visitors of the bar who probably never seen a dentist. One of the fantastic efforts was that the dentist started to use the media. Obviously, usually the dentists don't use the mass media at all. They don't go to the radios, they don't go to the local television and giving out talks and reports. And they done a fantastic work. We started to use the media, and we started to constantly communicating through different channels, obviously journals and daily newspapers and radios. Also, dentists started to become enjoying what they're doing. I mean, on the bottom you can read, this is one of the most important quotes from their report. I felt rehabilitated as a dentist. I am more responsible and I'm an accepted health professional more than ever before. They started to coordinating the work of the GPs, the health visitors, and obviously we had also a website where we started to communicate. We had a blog part which was locked and they had to use a PIN code, but other sites were open for the public. Unfortunately, in 2006, the new government decided that the program is not worth for running any longer, and the new Minister of Health announced his new program, which involved a rapid shift from prevention to treatment and a lack of interest in public health. Ever since, in Hungary, they have no preventative oral health program at all. After all this, in 2006, I left the country and I moved to West Wales in the United Kingdom, where I feel sometimes I live in an exile and I'm waiting that Hungary will return to a point where they see that they have to choose again the paradigm shift and they have to go back to the prevention. Until there, I hope I can start some useful public health program in West Wales where the needs are as high as in Hungary. Thank you very much for your attention.